Welcome. It is Wednesday, July, which I do every day, by the way. July 18th.
Let's get to our next guest. Hi and welcome.
Good morning.
It's a new prescription drug called Qsymia, right?
Qsymia.
Qsymia.
So it has just been received and approved by the FDA,
right?
Or?
That is correct.
Okay.
So just yesterday, the FDA approved this drug.
We should say this is Dr. Adrienne Youdim. Thank you.
Yeah, Youdim. So yeah, there you go. Sorry, we've had you on earlier. So what's the deal here? I mean, everybody's always looking for a pill to make everything better, right? Are there some side effects we have to worry about? What's the deal?
Yeah, so first of all, it's important to note that this is filling a gap in the treatment for weight loss. So until now, by and large, we've had diet and lifestyle, bariatric surgery, and not many medications.
Fen, I was on it, guilty,
right.
And by the way, I had to get off it because you recall back then, it got pulled.
Yeah.
That's right.
Women were getting heart palpitations and worse.
How do we know that this is not going to, you know what I'm saying?
Because it took a while for that.
So absolutely.
Now it's approved.
So absolutely. Like all drugs, this drug has known side effects. The most common side effects that we know of now are increased heart rate, which can be harmful in the long run if it's not noted, as well as birth defects if women who are of childbearing age are taking this, do not know that they're pregnant, or get pregnant while they're on the drug.
Okay, so that window has to be somewhere in them getting pregnant or being pregnant.
Absolutely. So somebody who wants to take this medication should be tested for pregnancy, should be on birth control while they are on the medication, and tested regularly while they are on the medication to make sure
people want the quick fix. Like Tony was saying, you want to drop that 10 pounds, you don't want to go the diet and exercise route, you've got a wedding to, there's like a time limit. But they always come with, you were saying palpitations. That's speed. It speeds up your system, right? So don't you have that with every diet drug anyway?
So to address the issue of, the lifestyle, absolutely lifestyles change, dietary change, exercise has to be used in conjunction with this or any medication that is used for weight loss. And we also have to note that for a lot of people out there who are obese and who have 30, 40, 50, maybe 100 pounds to lose, the diet and lifestyle is not going to be enough.
Right.
So this is
supplemented, so to speak.
So this is an adjunct. It's not a replacement for lifestyle, but it is an adjunct.
It makes you less hungry. And what is the average weight loss per week if you take this? Yeah,
so it really depends on your initial weight. The studies have shown that patients or people who are on this drug lose approximately 10% of their body weight. So if you're 200 pounds, about 20 pounds of weight loss is what you can expect.
It'd be $180, okay.
And that's the average. There is a range, on the lower and higher end.
Can you take it and exercise vigorously? Will that, because your heart rate goes up when you exercise, is it?
Absolutely. So the exercise is not a contraindication to the drug. And I think it's also important to say that while 10% or 20 pounds does not seem like a whole lot, maybe cosmetically, that is the threshold that we need to achieve to start to demonstrate changes in risk factors. So blood pressure goes down, diabetes improves, cholesterol abnormalities improve. So this 10% can be important to somebody who is obese and has a lot of the medical comorbidities of obesity.
Is this a doctor-prescribed drug, or is this over-the-counter?
No, absolutely. This is by prescription only.
You've got to monitor this.
It is by prescription only, and in fact, the FDA is put some limitations on that. It can only be obtained through certain pharmacies to ensure that responsible physicians are prescribing this drug and it's being used in the appropriate way.
Let me ask you something, and I will use fen as an example. The FDA approved that. And it was out there for years, and many women had heart attacks and things, and it got pulled eventually. Who's to say that this won't have the same problematic outcome and get pulled?
Or do they learn their lesson, the FDA?
So, I mean, you're right. When these drugs are studied in clinical trials, there is a finite number of subjects that are tested. In this case, about 4,000 people were tested with this drug. When you put this out on the market, there are many, many more candidates on the order of millions. And so the likelihood or the potential for other side effects to come about in the future is there and very possible. However, the FDA has mandated that the company continue to do long-term cardiovascular outcomes trials. So they will be monitoring the use of the drug as well as the side effects, and so hopefully things that will come about will be detected.
So this is more for people that are obese as opposed to a person who wants to drop 10 or 20 pounds?
This is not for any person who wants to lose weight. There are clear indications, and it is based on BMI and or comorbidities or the medical conditions.
So if you had a sister who had a BMI that was very high, real quick, I know we got to go, Dr. Youdim, would you recommend this?
I would say that if lifestyle has been initiated, diet, exercise, yes, it's a useful adjunct.
Okay. Excellent. Thank you, Dr.
Thank you so much.
Thank you.
Very helpful.
Good to have you here. When we come back, LAPD officers...